My name is Ivan Cheng. I'm an orthopedic spine surgeon at Texas Back Institute. So I was born and raised in San Francisco, California. Went to University of California, Berkeley for undergrad, Harvard Medical School, and went to UC Davis for my orthopedic surgery residency. Ended with my spine surgery fellowship at Washington University in St. Louis. And for 16 years, I was an orthopedic spine surgeon at Stanford University and actually made full professor in a tenure line. Since then, I've moved to Austin and have been in private practice, and more recently moved to Dallas to join the Texas Back Institute. You know, originally I thought I was going to be a physicist or an engineer. My father is a civil and structural engineer. And while I did enjoy the scientific aspects of that, I kind of missed the interpersonal interaction. And I found that medicine provided kind of both. You have the scientific aspect of things, but also the interpersonal relationships. So that's how I started thinking about medical school. When I did my rotation in orthopedic surgery, I just found that that was a great fit. I can remember very vividly one case that really changed how I looked at things. We had a 16-year-old kid who, at the end of swim practice, jumped into the pool, slammed his head into the bottom of the pool, and he dislocated his neck and was quadriplegic. They fished him out of the pool, got him right to the emergency room where we were on call. We took the patient right to the operating room, fixed him from both the back and the front of his neck, so reduced the dislocation, took the pressure off his spinal cord. And I'll never forget rounding on him probably about 2 days later, and he was standing and walking. And I had to check the chart and try to make sure this was the same patient, but indeed it was. And to make that kind of difference in a patient's life, I never thought would be possible. Somebody who was literally paralyzed a few days earlier had recovered almost everything within a matter of 48 hours. And that kind of impact I wanted to make in my career. And that's when I really cemented that spine was what I wanted to do. My interest in scoliosis, deformities, complex revisions really stems from my early days as a resident and working with my mentors on the spine service there. Both of them were really focused on the more complex spine disorders. But there are not many spine surgeons that are either trained or have the experience to do the more complex types of surgery. And I've really not only learned from my mentors, but learned during fellowship, but my experience at a university. You know, you're kind of the tertiary care end of the line place, right? And so patients would come from not only locally, but interstate and even internationally sometimes for that higher level of care. And it was really, you know, gratifying for me to realize, you know what, I have that training, I have that experience to treat these complex situations very well. I have experience in almost every approach to the spine, whether it's minimally invasive, you know, small incisions, minimally disruptive to the soft tissue, and when needed, the big open, you know, corrective surgeries. But I can do each of those things, and it's nice to be able to choose the right surgery for the right patient. There's no one surgery that fits all. So I have a lovely wife. We've been married for 14 years. We have two boys. One is 11, the other one is 9. And I adore my family. I'm very lucky to have you know, their support and their love. You know, I think spine surgery is hard enough. And if you don't have the support of your loved ones and support at home, I think it's really, really tough. But I am happy to get to do what I do and then, you know, get to enjoy my family at the same time. But I used to love mountain biking and snowboarding and playing volleyball and things like that. And I want to get my boys into those things, so I'm teaching them to snowboard and ski right now. They love, you know, outdoors activities and things like that. But the other thing is I'm kind of a nerd at heart. So I like video games as well, and my boys are super into that. So I'm kind of teaching them the ways of different types of video games. And I think it's funny because there's actually a couple papers to show that video games can enhance a surgeon's manual skills. At least that's what I tell my wife all the time, that I'm not wasting my time. But I think it's fun to do that. But I've developed a lot of different philosophies about patient care, and that comes just with time. I think first and foremost, the patient comes first. So whatever is best for the patient, I think is the most important thing. But the other thing is to customize the treatment for the patient. Not everybody's the same, and you shouldn't treat everybody the same way. And spine is one of those fields that's so complex. You really have to choose the right treatment for the right patient. And a lot of times that is not surgery. So I'm very conservative, which is, I think, a good thing in spine surgery. So I try to exhaust all non-operative things first. Yes, there are certain situations that are emergencies and really surgery has to be done on a more urgent basis. But the vast majority of the time, patients can get better without surgery. And that can be very appropriate. But I always tell patients that it's a journey together. This is not a one-time thing, So you have to have a good relationship with your surgeon and treating physician as well. When I think about what I want my legacy to be as a spine surgeon, I think there are many levels to that. There's a level that I want all the patients with whom I've had interaction to say, I made a positive impact in their lives. That, I've affected thousands of people positively with my, treatments. And I think that would be incredible at the base level. On a higher level, I hope that I can be recognized as somebody who made a difference in my field. That not only did I influence trainees and helped build their practices and their careers and their knowledge level, but also changed how we treat the spine, period, through leadership, through research and mentorship. Those are all things that I hope I can look back on and say, I really made it. And I made a difference not only for patients, but residents and fellows, and made a difference for spine surgeons around the world.